Shot of downtown Toronto, BT Studios. Good morning, Toronto. Good morning, Canada. This is Breakfast Television. My name is Sid Cicero. In recent months, the Canadian Cancer Society has noticed a 160% increase in people online looking for more information regarding COVID-19 and cancer. As you know, as most of you know, a lot of procedures, a lot of treatment has either been postponed or rescheduled because of the capacity in our hospitals. And people are obviously anxious about this. Today we're speaking with patient advocate Melodie Cyr and Stuart Edmonds from the Canadian Cancer Society about the impact of the pandemic on a lot of people. To both of you, good morning. Thank you for joining us today.
Good morning.
Melodie, let's start with you. Walk us through your experience. What has happened to you?
So in 2020, I was supposed to receive a biopsy for a nodule that was sitting on my thyroid gland. And the day before the biopsy, I received a call and they said that all non-emergent type of procedures were canceled due to COVID. And I said, why? And they said, well, thyroid cancer is not an urgent type of cancer. And I was just baffled by that thought. And it took me an entire year to receive my biopsy. And they finally realized that there were precancerous cells in the tumor. And I received a surgery to remove half of my thyroid.
So try, if you can, to explain to us what it's like to sit there for 12 months and have this on your mind, all of this uncertainty.
It was very stressful and frightening. As a PhD student in medical physics, I study cancer for a living, and knowing all of the side effects and knowing how scary cancer can become, I was frightened every day. I was touching my thyroid every day because I could feel the lump. However, I was surrounded by a lot of family, and I had the support that I needed to overcome it.
Dr. Edmonds, does this wash with what you're seeing as well, what your colleagues are telling you?
Yeah, this is awful, and this is unfortunately, Melanie's story is not unusual in this time, and we're the Canadian Cancer Society deeply concerned about this, about the delays in both treatment and in surgery and in screening programs, and the impact that's having. We know that just a delay of 4 weeks in cancer treatment can lead to an increase of risk of cancer death by 10%, so a significant impact. And the delays in screening programs equally are going to have a huge impact on many people in coming years when we're not diagnosing cancer early enough to treat it effectively.
Doctor, I mean, if you're a family member, if you're a loved one, and you know someone who's going through this excruciating wait to get a procedure that under normal circumstances would happen so much quicker, I mean, what tips do you have for them? Because the support system is crucially important in that moment.
Well, we have a number of support services we can offer to provide them with advice. So they can call our cancer information helpline, or we have a cancer connection program at cancerconnection.ca where patients and caregivers can talk to others in similar circumstances and understand ways to navigate through the system. But it's really not ideal at all right now, and certainly what we're trying to do is urge governments to continue to prioritize cancer during the pandemic, and we're asking actually people in Canada to join us and actually write to their MPs. They can go to cancer.ca, World Cancer Day, and actually write to their MPs urging them to maintain a priority on cancer.
Melodie, final word to you. You concur with what the doctor just said? More pressure on our public officials?
Absolutely. I was told to give notice to my MP actually about the services that were being denied to me. And unfortunately, I did not do that. However, I did push a lot on my medical team that were handling my case, and I was able to receive my services slightly faster.
Well, that's something. Melodie, all the best to you. Dr. Edmonds, we appreciate your perspective here. Again, go online, go to the Canadian Cancer Society. There's a lot of info there, and Hopefully we're out of this. I wish I had a better closing line than that to the both of you. I appreciate the both of you. Thank you.
Thanks for
Thank you
shining a
so
light on
much.
this.
Take care.